I thought I'd make a list for new grad sonographers of tips that can help you be the best sonographer you can be and improve your skills. These are pretty simple tips, but I think they can be really useful. My first tip is to learn to scan off axis. When you work inpatient in a hospital, you're going to be scanning a lot of patients on their backs. I have actually learned to do full studies through a subcostal view. I've had patients with 0 windows besides for a subcostal window. This is common for patients with COPD and lung disease. So basically I learned to scan the entire echo through a subcostal window. It's still better than nothing. You're still giving the doctor all the information that they need. You should also get good at a subcostal short axis window. I find many times if you can't get a good parasternal short axis, you can get it beautifully in subcostal. Learn to scan patients on their backs. I know ideally you want them on your left side and that's where you're going to get the best images, but a lot of times with inpatients, you're going to have to scan them on their backs. If they can, make them roll up on their left side as far as they can go. Always try to reposition your patient. You really should be utilizing your dropout tables if you're scanning on an echo bed. You want to be utilizing breathing exercises. I use breathing exercises on almost every patient. You would be so surprised with how much breathing exercises can clear up an image. Learn your machine. You should be optimizing your image with every patient, and you want to learn all your machine settings. Settings can make or break a study. You can go from having really crappy images to beautiful pictures just by adjusting your machine settings. In every single view, you should be readjusting your settings. And my last tip of advice is to label everything. I put my patient position, I type it right in on my screen so it's right there on my images. If the patient is supine, I label if I'm doing a bubble study, I label if I have no IV access. And then I'm also going to put in my report why the patient was difficult, why the images were difficult. Explain to people and the doctors why your images look the way they do, because sometimes you'll have an outpatient that comes in and they'll get perfect images and then they'll come to the hospital a couple months later, can't position them how they need. The patient had breathing complications. There could be so many reasons why you're not getting good images. So it's kind of just showing that you're doing a good job still, and not that you're a crappy sonographer that just doesn't get good images. I have so many more tips I could give. These are just a few of them that I think are really important. Comment down below if you have any questions, and I'll try to answer them all. Also, if you want me to make videos on any specific topics, please comment down below and I will try to do that for you guys.